Good afternoon from beautiful Barcelona, and thank you so much for joining us today. I am Alexis Roch, CEO of SciTech DiploHub, the Barcelona Science and Technology Diplomacy Hub, and I'm going to be your host today. We're living in unprecedented times. The COVID-19 crisis is hitting our societies, economies, and ways of life on a scope and scale never seen before. Major crisis place deep stresses on the ability of our society to respond quickly and effectively to safeguard lives, health, and social well-being. Scientists from a broad range of disciplines are critical for building an effective response to such crises. Their knowledge is essential for shaping and understanding the options available and communicating that information to decision makers. There has been plenty of research on the role of science in predicting and preparing for health crises. However, less attention has probably been given to the integration of this knowledge into public health policy, diplomatic action, and global mitigation strategies. We find ourselves in a moment in time when bridging scientific knowledge and diplomatic practice through science diplomacy is more important than ever. With millions of people scaling up their efforts to help mitigate the virus by confining themselves at home, we have the responsibility to bring scientists, international relations practitioners, and global health experts to discuss science, diplomacy, and pandemics. It is now time to open up and bring in-depth analysis and expertise to the public debate. To this aim, at SciTech DiploHub, we have partnered with other international organizations to put forward 5 sessions online with leading world experts on science diplomacy, geopolitics, technology, and global health. These 5 sessions, taking place every Thursday, will explore the role of international cooperation in the current crisis, the European response to COVID-19, the impact of cities, and particularly global cities like Barcelona in global mitigation efforts, the response to pandemics in Ibero-American countries, and the threats and opportunities that new technologies being used to track citizens during this crisis might pose. While we are living one of the most disastrous weeks in the history of global medicine and global economics, country after country are retreating into their national silos. They are fighting their own individual battles against coronavirus and in their own way. Each country has, of course, its own distinctive health system that it relies on, rightly values its own medical experts, and the disease is a different stage in each. But why is there, so far, no internationally coordinated medical project able to mobilize all available global resources to discover a coronavirus vaccine and to fast-track a cure? Why, as the disease engulfs more than 100 countries, has there been no consistent, coordinated global approach, not just to tracking, testing, and limiting mobility, but openly learning from each other about the relative merits of quarantine and social distancing? Is there a need for new forms of multi-level governance to manage our response to COVID-19? How can science diplomacy improve virus mitigation and response strategies across boundaries? To shed light on some of these questions, today we are fortunate to have with us 4 world-class experts in global health and science diplomacy. We have with us Dr. Julia MacKenzie, Senior Director for International Affairs at the American Association for the Advancement of Science, the AAAS. Good afternoon, Julia. Dr. Antoni Plasència, Director General of the Barcelona Institute for Global Health, ISGlobal. Molt bona tarda, Antoni.
Bona tarda, good evening.
Good evening. Dr. Ilona Kirchbuch, Founding Director and Chair of the Global Health Center at the Graduate Institute. Dr. Kirchbuch is now having some troubles with her connections. We hope to have her back in a few minutes. And Dr. Lorenzo Melchor, Science Diplomacy Officer at S44C, and EU Science Advice and Diplomacy Officer at the Spanish Foundation for Science and Technology. Buenas tardes, Lorenzo. Welcome, and thank you so much for joining us today. So let's kick off this session. Dr. MacKenzie, Julia, could you introduce to our audience what is science diplomacy and why is it so relevant to better address global health crises such as the current pandemic? What activities are currently being developed by the AAAS in this direction?
Thank you. Can you hear me okay?
Yeah, sure.
Great. So I think a simple definition that I think works for today's exercise of science diplomacy is simply diplomacy that's relevant to science and science that's relevant to diplomacy. So we're talking today really about health diplomacy. And I think what pandemic is, really perhaps the most compelling, certainly it feels that way right now, reason to think and practice science diplomacy. Pandemics are by nature transnational threats. By definition, they're transnational. They certainly have no regards for borders, and no single country can combat them alone. So I think, it's kind of a useful thought exercise to think about the early days of this when it was an outbreak, because I think it reveals something about what science diplomacy, health diplomacy is, and why it matters. So it first and foremost requires real diplomacy. So in this case, a unique cluster of pneumonia patients in Wuhan was reported to a multilateral health authority, the World Health Organization, and those systems had to be in place pre-crisis. Those are diplomatic relationships. Those are multilateral relationships. They require a baseline of trust, even among partners who don't agree on everything, which is kind of a cornerstone of diplomacy generally. Done right. So from that point to a freely available genome sequence of this novel virus, it was a roughly 2-week period, which is really remarkable. And lastly, it of course requires that science be trusted. So I think this is a wildly complex problem taking place in our wildly complex societies. And it requires speed and transparency in response. So the speed can be brought to you by those pre-existing relationships I referenced. And transparency, I think, while not being a strength of politics or politicians generally, it is a foundational strength of science. So I think where most of us are now in the phase of this pandemic is really revealing that in far too many places, science is either not trusted, not listened to quickly enough. And it also seems, I think we have to be fully reflective with ourselves about this too. It also seems there were cases of, bad science advice given, and that being a loss of time. So at AAAS, I think we're a complex organization ourselves. We run, we're a premier publisher of scientific content, and I can tell you that what is happening now in our publications is revealing that, in fact, there are international efforts well underway to combat this pandemic. The science is getting out very quickly. It's getting out in preprint servers, and then we are still providing the really valuable validation and peer review of those results and getting them online as quickly as possible. We have a long-standing, it's not a new policy, we have a very long-standing policy that anything of public health importance is published immediately and is available to all, and so that still stands. We are reporting on the pandemic. We have reporters around the world who are working around the clock reporting on this. A very highly cited question and answer with a US authority on this pandemic, Dr. Antoni Fauci, was published, I think, just 48 hours ago in our Science magazine, and has been viewed millions and millions of times and cited by a lot of mainstream general interest media outlets as well. And then we also, where I sit specifically in our organization, is, among other things, I direct our Center for Science Diplomacy. So there we're doing programmatic work that's intentionally focused on where not only the thought leadership about science diplomacy generally and training for science diplomacy, but also we have a portfolio of programs that are focused on where diplomatic ties, in our case specifically with the US, are either severed or strained, but where international collaboration needs to flourish nonetheless. And so that's, I think, also really the relevance of such programs is very obvious in the face of a pandemic. A virus doesn't care who's getting along, what countries are getting along, and which countries aren't. So.
Well, the reputation of the AAAS, and especially the Science Diplomacy Center at AAAS, is well known all across the globe. Given the work you have been doing for the last 10 years or more in science diplomacy, so your inputs and insights are really valuable for us. We're gonna move on with Dr. Plasència. It is clear that compared to the time of the SARS outbreak in 23, China is not only much larger economy, but also vastly more interconnected. Given that, how does this new paradigm of the connected society translate to the dynamics of the global response to the COVID-19 pandemic? What are the implications for the perspective of global health and crisis management from your opinion? Now it's fine.
Can you hear me now?
Yeah.
So thanks very much for the invitation and for the question. Let me just say that my views are, I work at an academic institution in the area of global health, and so basically our vision is from the area of research, but also of translation, and this also involves both in high income and low and middle income countries. So regarding your question, first of all, we need to keep in mind the context, the global health context where we have been until very recent times. So, for example, we knew that disease X was coming sooner or later, and now it's here. And by disease X, that means something that could be caused by a pathogen currently unknown to cause human disease, and that could be causing a serious international epidemic or pandemic. So here we are. We also knew that about 60% of the pathogens capable of causing symptoms originate in animals, what we call technically spillovers, and this is also the case. And we know, by the way, that about 1.7 million, almost 1.7 million, there are about 1.7 million unknown viruses infecting animals on Earth and potentially, therefore, generating spillovers. And of course, we know that in the current interconnected world, that means very easily anything that can be spread can be very easily spread throughout the world, where we have about 500,000 people up in the air at any given time during the day. So definitely we knew all these things, and if anything, the Ebola epidemic, the Ebola crisis, starting in 2014, generated a reactivation of global concerns regarding the need for preparedness. And therefore, based on that, different institutions, among others WHO, established the need to generate knowledge, to generate tools, such as vaccines or drugs, to be able to respond to some of these threats. And SARS, since we had there had been an episode or the SARS one experience in 2003, 2004 was in that list. So we knew also that SARS deserved a special attention. And we knew also in response to that, in the last 3-4 years, there's been different initiatives, global initiatives, like, for example, the Coalition of Epidemic Preparedness Innovations, the CEPI, through a partnership between different stakeholders, public and private and philanthropic, to precisely to ensure the development of tools, of vaccines, of drugs to face these threats. And finally, let me say then there was also out of the initiative of the UN recommendations, the creation in 2017 of the Global Preparedness Monitoring Board as an independent body to ensure preparedness and to monitor what countries are doing to respond to that. And so basically the setting was or is that areas like leadership, like health systems, like financing, like international coordination mechanisms are key for the response, and therefore that all countries should be working to respond to that. But let me say that in the last report of this Preparedness Monitoring Board, which is from September 2019, there was a specific chapter on preparing for the worst, and specifically mentioning an airborne disease such as the one that we have right now. And therefore some of the issues that were raised was largely the lack of planning and readiness to rapidly to face a rapidly moving pathogen, the challenges of data sharing and medical countermeasures as a public health emergency of international concern, and finally the challenges of research and development, which I'm sure we'll have the opportunity. So on the one hand, the situation takes us probably better equipped than ever before with different initiatives and different platforms to face that, but we still see, and that comes out of the data that is being generated on a, I was going to say daily basis, but I should say on a minute basis, we still see that this is not enough, and that countries are now in a very in a deep crisis. So definitely that means that despite the great progress that has been made, we are still dealing with pandemics as basically based on a disaster response model, and that's definitely not the case. So I hope we'll have time later to see what are some of the elements that are being evolved, and maybe some of the challenges that we have for the responses that we can have for the future.
Sure, we'll have time for that. Would you say that maybe some of the main differences in how this crisis has been managed in some Asian countries, particularly China and South Korea, compared to the West, are due to that they had to face previously, some years ago, other outbreaks like SARS or other similar epidemics?
Yeah. For the case specifically for the case of China, definitely China learned what at the time was not seen as a well-managed situation with SARS, and thus learned a lot and developed a lot of capabilities, and so definitely the both the capacity to detect, the capacity to manage, the capacity to generate relevant knowledge, of course the capacity to intervene, as we've seen, has changed radically since for the last 20 years. That's for sure.
Okay, thank you, Dr. Plasència. We're moving on to Dr. Melchor. The current pandemic, Lorenzo, has revealed that many opportunities in science, diplomacy, and multilateral cooperation are probably underexploited. How do you assess the use of science, diplomacy, and science policy advice in the context of global epidemics, and what do you think are the main lessons learned from this outbreak?
So hello, can you hear me?
Yeah, I can hear you.
Yeah. Okay. So first of all, thank you very much, Alexis and Barcelona SciTech DiploHub, for arranging this outstanding webinar series. And I'm particularly thrilled to be part of the first of those. So before addressing your question, I'd like to briefly introduce what the S44C European project is about. This is the Using Science in Diplomacy for Addressing Global Challenge. And we are living a global challenge like the pandemic of the coronaviruses. So S44C, which is the acronym of this project, brings up to 10 different institutions, from research centers and universities to also international organizations, diplomatic academies, and public foundations. But this is important because it brings a myriad of different professionals, from researchers to policy managers to diplomats and to science diplomacy practitioners. And we are approaching science diplomacy with a double scope. On the one hand, S44C is doing research oriented to identify how science and diplomacy is relating to each other in 9 empirical case studies. One of those is actually infectious disease and how 3 member states and the European Union dealt with Zika and also with previous infectious diseases spreading across the world earlier, like SARS or Ebola. And that case study report has been out like a couple of weeks ago, so I encourage everyone to go online to our website and download it. But the second pillar of our S44C project is the policy-oriented approach. We want all our empirical case analysis, as well as our conceptual analysis of what science diplomacy is, to have a kind of an impact in the policy realm, in the European Commission, the External Action Service, and also the member states' governments. And so we provide policy reports for these organizations to implement better connections between the scientific and the diplomatic community. So going back now to your question, you actually said, and I quote, "The current pandemic has revealed that many opportunities in science diplomacy and multilateral cooperation are underexploited." In one of our policy reports that was launched 1 year ago, the Madrid Declaration on Science Diplomacy, we actually have this as a cornerstone of our vision. The following sentence: "Science diplomacy is often not fully exploited at all levels of governance, and especially at supranational levels." So even before this outbreak, we understood that science diplomacy is a tool that is yet to be fully harnessed by governments. So from S44C, under this current situation, we have created a special task force to analyze the current scenario and to provide with a policy brief to the media and especially to governments what is our vision of what's going on and how the scientific and the diplomatic community could relate to each other much better to tackle this disease, but especially to tackle global threats that are still present and that will be taking place in the coming years. So now, with the coronavirus crisis, we are living a historical situation. I think we all agree that the way we live is going to change. The way we travel, the way we work, the way our nations...
The way we organize panels.
Exactly. So allow me to give you some of our highlights of this situation from the S44C consortium. We at least see 3 opportunities in this scenario, as well as 3 big challenges. So I will start first with the opportunities. The first opportunity is a scientific opportunity. Science and research are in the global spotlight. I mean, now scientists, medical experts, global health professionals, and other myriad of experts are being on television, on the media, and especially on government rooms, advising and providing information for policymakers to take specific decisions in order to tackle this situation. So the general public is also waiting for scientists and researchers to find a cure for this disease, or to develop a vaccine, or to develop better diagnosis techniques, or even better healthcare equipment to liaise with all these outbreaks. So when we mention science and research, allow me also to emphasize that we also include social sciences and humanities. The value of these scholars in providing advice as to how the general public is going to react under certain policy solutions is utterly important. So when we say science, social sciences are also included. So I think we understand that science is globally understood as the one that is going to be providing a technical solution for this global threat. A technical solution. Okay? So that's the first opportunity. The second opportunity is a science diplomacy opportunity, because the interaction spaces for science, policy, and diplomacy are growing by the minute. Across different countries and across different government levels, we see governments taking advice from scientists, from health experts, to understand how this disease operates, and how it's spreading, and how we can contain it. Government science advice is being harnessed, and we will be able to learn a lot from what it has worked, or what is working, as well as what is failing, or what it has failed. Scientists are collaborating internationally. So on the other hand, science and diplomacy are getting to know each other quite a lot now, because on the one hand, there is the international scientific cooperation that is seen when scientists are providing preprint publications in open repositories, the open access to all this information, as well as sharing data and all kinds of expertise. And from the diplomatic point of view, scientists, medical doctors, and medical supplies are now also shared between countries. We've seen it with China, sending over scientists with the expertise and medical doctors with the expertise to liaise with this outbreak in some countries that are of need nowadays. Yeah. So China is using this disease to improve his image as a global power. And in the coming months, we shall see how the countries that are now in the peak or close to the peak of this disease, let's see how they use it in the future to help other countries in their area of influences. And the third opportunity is a diplomatic opportunity, because this is a tangible global threat that may provide a window of opportunity for more multilateralism as well as for collective action. We live global threats, and climate change is a global threat, but climate change is elusive. You don't really see it. It's happening over a long time. Yeah. Whereas this global threat is happening now, at the moment, and it's bringing our countries to the brink of collapse. Our welfare states, our health services are collapsing. So, of course, this emergency situation could strengthen the role of international organizations like the World Health Organization, could strengthen the European Union project if the right decisions are made, and could improve the bilateral and multilateral collaborations that are taking place between different countries. But okay, these were the opportunities, but these are challenging times, and we face different challenges, and those opportunities are going to cope with certain challenges. So allow me to quickly say the three challenges that we identify. On the one hand, there is a big conceptual challenge here. So this is something that we also found it in our case study that was analyzing Zika virus and the way our member states and the European Union responded to that issue. Health diplomacy has more traction in the diplomatic community and in the diplomatic language. It has a long, mechanisms that has been long established that are operating at the moment. And in that regard, it's better understood that science diplomacy. And this is because science diplomacies may be just an umbrella for many niche diplomacies, like health diplomacy, water diplomacy, cyber diplomacy, and many more. And why is this? This is because science and research and the knowledge, the scientific knowledge, is transversal. It matters to any issue you are discussing. It's not a silo in itself. So the state-of-the-art scientific and research knowledge is important for any issue. And maybe in policy making and in the diplomatic community, going back to know what the research community knows about a specific topic is not that rooted. It's not that consolidated in our policy makers or in our diplomats. And this is because we build up silos and we build up walls in our personal and professional lives to better operate with our daily routines, to better develop our specialist techniques. But science diplomacy is meant to bring those walls down. Science diplomacy is meant to better coordinate and build up cooperation between different government silos, like the scientific and the diplomatic community, like the scientific and the health community, and many more. So even though health ministers and health specialists and managers will be taking the floor, will be taking the stage, we need to speak up for those science ministers or those science advisors who need to push their way in the decision-making table, to push the evidence forward, to advise the health specialists, but also the policymakers to take the right decisions at any moment. The second challenge is the challenge.
Agree more, Lorenzo. If you don't mind, yeah. we'll delve into that later on. We're going to make the most of the opportunity that now we have Dr. Ilona Kiszbusz online. Yep. Good afternoon, Dr. Kiszbusz. We are delighted to have you back. Can you hear us? Seems she cannot hear us. Well, it seems we can see her, but she cannot see us. So what a pity. We'll try it again later. I wanted to ask to Dr. Plasència maybe, but to any of you who would like to reply. How, given that the COVID-19 outbreak has shown a clear lack of operational capacity, preparedness, and coordinated mechanisms to face global health crisis, in your opinion, do you think that we need new forms of multi-level governance to better manage our response to pandemics? And in such a case, what are the main bottlenecks and what principles should guide these new tools that should be implemented?
Is that the same way that pathogens don't know about borders, the same way science doesn't know about borders? Unfortunately, what we're seeing is that governance and the technical response still behaves pretty much within borders. So definitely, I think that's what we're seeing is that the responses that have that were reasonably rapidly implemented in China, in Korea, in Southeast Asia, were not followed as rapidly in European countries, by European countries. And therefore, I think that that's, and at the same time, the science, I think one of the strong differences with previous global public health crises is that really the wealth of knowledge that we are able to generate and that we are able to share is absolutely impressive. So, of course, there are many uncertainties. Of course, there are knowledge gaps. But I would place at this moment the real bottleneck in the interaction between global science and, I would say, more local and regional responses. And so that definitely brings a question of, both in terms of governance, in terms of diplomacy, what should be done to overcome those bottlenecks. And I don't have a clear response for that. I think that if Ilona is hearing us, I don't know if Ilona you can hear us. Yes,
okay,
she can hear us.
Amazing.
So maybe she can
so now
also
we can hear you.
speak.
Sure. So thank you so much, Dr. Plasència. Ilona, so we would be delighted to hear your answer on.
Did you want me to say something now?
Sure, definitely. Yeah.
Yeah.
Yeah, please. Can you hear us, Ilona? You can go ahead.
Can you hear me?
Yes.
Yeah. Yes.
Yes.
Could it be that you can hear only some of us? Because I see
yes,
you reacted to my comment, but not to Alexis. So maybe
she has her preferences.
So I'll bridge the two of you eventually.
I didn't hear the other. Yeah. Yeah, I think one of the things that we've seen is that there is an increasing global cooperation in science. You know that the World Health Organization now has a chief science officer, just like the World Bank has a chief economist, so WHO has a chief scientist. And there have been increasing scientific cooperation, particularly since the Ebola outbreak in 2014, 2015. And one of them, of course, is the big vaccine cooperation project that is called CEPI, where many different science corporations have also worked together. Something interesting is happening there, and that is something the other colleague referred to, that through those kinds of initiatives, the science ministries of the countries are getting more involved. So if I take Germany, for example, the global health activities in science are done by the science ministry, and the money for CEPI, for example, comes from the science ministry. And maybe that's an interesting example because the German Ministry of Science has created a significant department for global health research. I don't know how many other national research bodies actually have that. And so that department has the task to really get involved in the global health initiatives, to finance them, to initiate them, but also in a very interesting way to actually get national scientists interested in global health. Because what we have experienced is that scientists don't necessarily define themselves as being in global health. You know, I'm a malaria scientist, or I'm a virologist, or whatever, but I don't think I belong to a global health community. And one of the things that has been happening is actually to get these scientists, and one of the leading virologists in Germany, for example, Christian Drosten, who is now advising the government, came into global health in that way. And he said, you know, I've never seen myself involved in science diplomacy or global diplomacy or things like that. But when you invited me to be in the advisory group to the German government on global health, I suddenly started to understand what that was. And another very practical outcome of that is, for example, the big university hospital in Germany, the Charité in Berlin, has now also created a global health center. to say all the many health projects, some of them small, some of them large, in our enormous university hospital are now being brought together so that we can be a joint voice in global health. So I think that combination between strengthening the national basis and bringing all that extraordinary national expertise in research relevant to global health together. You know, also the national academies, for example, should play a very, very important role. And then to link that to the global initiatives. And of course, WHO has tried more and more to bring research together. You know that following the COVID outbreak, one of the first big conferences, when you could still hold conferences, was in Geneva, bringing all the leading researchers that are of relevance for COVID together. So I think we're seeing a shift, but the key issue is, and I don't know if it's been raised, is of course all the issues of what of this research constitutes a global public good, how will that knowledge be applied, and if the knowledge leads to a vaccine, will that vaccine be available to everybody, or will it then be a UK vaccine or a US vaccine? The German vaccine development companies, in order to have earlier access to a COVID vaccine than anyone else. So you start to get very soon into these proprietary issues, and where either, you know, you are of the opinion like Stiglitz to say knowledge is a global public good, and the health knowledge that comes out of these joint efforts needs to be a global public good and needs to be made widely accessible. And I think here we still have a whole range of very important take, you know, that the Gavi, the Alliance, has taken an approach of developing new financing mechanisms for this kind of research cooperation, and then from the very start to actually ensure that the medicines that are involved, vaccine or other things, then actually are universally available, that they are stockpiled and that they are shared. But even within the European Union at present, you know, we're not so sure how we want to share knowledge and how we want to share vaccines or any of the other products that might come out of this kind of research. So there's a lot of governance challenges there. And of course, regularly at WHO, the intellectual property challenges are discussed again and again. The pricing transparency is discussed again and again. And that's really where science diplomacy and health diplomacy come together very, very strongly. And where, though, at the basis, it needs a cooperation at national level between the foreign ministries, the health ministries.
Yes, actually, we were mentioning that just a few minutes ago on the lack of cooperation between countries on that issue. And actually, next Thursday webinar is going to be particularly about how European Union as an institution and the European member states are or are not actually cooperating enough in order to find a joint solution for this outbreak. Before we move on to the Q&A from our audience, we have plenty of questions from our online audience. I'd like to share with you one last question to all of you on the prospects for the future. Do you think that the COVID-19 pandemic will lead to a stronger voice of science and technology in international relations and in diplomatic action? And if so, will it give rise to a more proactive preparedness culture in the future that as Dr. Plasència was pointing out earlier, uses prevention to detect, for example, infectious disease in wildlife before they significantly impact human health. Do you think that it will contribute to strengthen the links between clinical evidence and policy making? We can maybe start with you, Julia.
Sure. I mean, in brief, the answer I think is yes. I mean, I think we have to be hopeful. I think, as I mentioned earlier, I think it's early to be unpacking all that went wrong in this pandemic and the things that went right as well. But I think that time will come, and there are certainly aspects of preparedness that may have gone out of fashion, or, you know, at any political time in any country are either in and out of fashion that will be in fashion for quite some time afterwards. I mean, this is a threat that we haven't faced. I mean, it's always remarkable to think on, well, I haven't faced this, but have my parents or did my grandparents? And this is really a, you know, it's been over a century since we've faced quite a threat like this. I do think it will have eventually positive outcomes in terms of preparedness, and in terms of the value of science and also the realities of science. I'm wary of any promises about just how quickly a vaccine or a cure, or even a, you know, a pharmaceutical that helps with symptoms. Those, I know officials in the US are taking care to reiterate again and again, even ambitious timelines for those outcomes are, they're not tomorrow.
Sure, thank you. Dr. Plasència?
Yeah, thank you. Let me say that there are, I'm sure, many lessons, and it's very early. But just the picture of the variety of responses in the European Union or in European, among European countries, with the same information, the variety of responses and rhythm of responses clearly shows that there's not enough with science. There's not enough about evidence. And although we are hearing very often leaders mentioning science, but I think there's a certain risk. So the good news is that science is there and it's available and it's closer to policy and decisions. But at the same time, there's a certain risk of a political using science as a political shield to somehow to justify some decisions or lack of decisions that are really not necessarily based on science, but based on other definitely real challenges. So I think we need to be able to work in depth into this interaction between politics, policy making, science, and of course, and the public. So that's definitely a challenge for the future. Let me just bring a very quick issue, because we haven't seen nothing yet regarding the pandemic, because it's just hitting very fastly, by the way, low and middle income countries. As we know, it's going to be difficult to really appraise the impact due to the lack of diagnostic and capacities. So it's there, but it's only emerging. And at the same time, it's a perfect storm, because it will bring an unprecedented pathogen together with already a very heavy burden of disease. In the case of Africa, including malaria, including HIV, which means also lack of immunity, TB, and other infectious and non-infectious diseases. So really, the challenge of the situation also needs to bring in the picture low and middle income countries, and this interaction between science, policy, and the role of diplomacy, I think, needs to be looked at very thoroughly. Thank you.
Thank you. Lorenzo?
Yes, so to answer what are the prospects of the future is to answer whether we are able to tackle the three challenges that I was mentioning before. I told about the different frictions between health diplomacy, science diplomacy, and the way science can be feeding information to all different governance silos. The second challenge is the governance level and the miscoordination of governance levels that we may be witnessing, or from international bodies from like the WHO, World Health Organization, to supranational entities like the European Union, member states, but also at the subnational level, regions and cities are all taking actions in this regard. And S44C is related to Europe, so allow me to spend 1 minute on how Europe is facing this. This is a key moment, as it is an opportunity for the EU to demonstrate it is a lively project of integration and coordination worth keeping and further strengthening. But obviously, we need to take specific decisions to make this happen. On the one hand, we've seen good coordination efforts from the scientific funding schemes, the Horizon 2020 response, for instance, calls of the Innovative Medicines Initiative, and also all large research infrastructures, European research infrastructures, are giving help, giving support and assistance to researchers all across the world to find a cure for this disease. But on the other hand, we are witnessing a re-emergence of the nation state as the government structure that is there to cope with this type of threats or emergency situation. We are witnessing how there is not an adequate coordination on data collection and monitoring. How you are counting down infections or how you are counting down deaths is different in one member states than in others. So this causes lots of complications if we want to build up a coordinated response. And also the access to medical supply, different member states are getting pile of more than they previously needed. Well, we shall see how the European Commission must prove its weight and effectiveness and how it responds and gives coordination and coordinative action support to the member states that are being most hit by this disease. But at the subnational level, there are also frictions occurring. I mean, there are regions and cities that are speaking up and telling off their national governments they are not taking the right actions. They are even pointing out there is scientific evidence that is disregarded. And this is because also the national political context comes into play, and politics comes into play and alters everything. And the third challenge is the fact that science advice is now being given in a moment that is very difficult and challenging. And science, we like science to be 100% accurate, and politicians want science information to be as accurate as possible, and that's not the case in many cases, but especially with this whole situation. The whole scientific evidence is not as solid as we expected. We are still trying to understand how the virus operates and how it can be stopped. So we have to remember that science advice is just one piece in the whole decision-making process. And we are witnessing some countries that are putting the scientific evidence on the level, but also the value of economic and market. And at some moment, one is overweighting the other one. We need to understand that the decision-making cannot be based only on scientific evidence. And we need to respect that on a democracy level. However, we need to fight to make the scientific evidence more influential. We need to understand how the scientific advisor can be more persuasive at putting these evidences on the table. But other aspect that is very important and challenging in this science and policy interface is the fact that how are these scientific advisors operating? Are they being honest brokers, pursuing political interests, or the other way around? Are the political leaders shielding themselves on the scientific experts, on what they are saying, the scientific experts, just to make excuses in the future if something doesn't work? All of this we'll have to study it and learn from the experience. So we should be able to understand how science advice ends and where political choices begins. But if the line is blurred during the process, then we'll be learning nothing and we'll be making big blows to this science and policy interface. So in conclusion, this COVID-19 situation gives us plenty of opportunities, but under a very challenging scenario. We are optimistic. We think we are going to learn from experience, and we are going to put some mechanisms into place, and let's hope for the better.
Let's hope you're right. Ilona, there is anything you would like to add?
Well, I'd like to agree with that very much, and that is what we are learning is very difficult lessons about decision making under uncertainty. And one of the problems at present is that to some extent politicians, but also the general public, is expecting certainty. And for a long time, we have all been calling for evidence-based policy and similar things. And it's quite clear that at present we don't have straightforward evidence. And, you know, there's a lot of projections and mathematical model calculations, and probably also not enough is being done to actually allow the public to understand what these graphs that are everywhere now and everyone is looking at the breakfast table actually mean, and what implications they have. So I think it's also a fascinating opportunity to think about science literacy of the general population. I think, you know, people don't understand statistics. What does it mean 5%, and what does a death rate of 0.1 or 0.8 mean, etc. And so I would urge us, particularly in democracies, not only to think about this relationship between the scientists and the politicians, but also about the scientists, the politicians, and the general population, a long-term project also on science literacy, which I think we have neglected, and therefore trying to take the complexity of the decision-making process also into the everyday lives of people. Because, you know, the more difficult and the tougher the decisions are between staying at home and economic development and medical decision-making, you know, everyone's suddenly talking about triage. What does that mean? And therefore, I think we still have a long way to go to actually take the public with us. And in a democracy, I find that is absolutely essential. So we need a new kind of mix between science literacy and health literacy in order to deal with a pandemic like the one we have.
Thank you, Ilona. Well, I think it's time to open up the floor to 5 questions. Obviously, we won't have time to answer all of them. Our team, Pau and Martí, has selected some of them. Well, I just throw them, and if any one of you would like to reply. Rosa Oriols asks, how can global governance put global health at the center? Or another way to rephrase it, as we saw, as Danny Roderick was suggesting several days ago, how other possible globalizations could exist, not centered only in the economic perspective. Anyone? Julia, would you like to add your thoughts on that? Can you hear us, Julia?
Sorry, you're freezing. Can you hear me?
Oh, I'm sorry. Yeah, sure. So in case you didn't hear the questions, somebody from our audience was asking how could global governance put global health at the center? How globalization could be not just centered on economics, and how science diplomacy could play a role on that?
I mean, I think there are, like I cited about the early days of what was an outbreak. I mean, there is some global health governance with the World Health Organization. There are things like the professor noted, the Pandemic Preparedness Index. I think this is such an urgent and on a massive scale reminder of why it's important that those global governance structures or those global resources exist, that it will compel action on multiple levels. The national, in the US, which is an incredibly complex country, it'll certainly spur action that's different state by state. But I think it'll happen at every level, including the supranational. I think it's as an outsider, I think it has a real opportunity to make the European Union stronger, for instance.
Awesome, thank you. Anybody would like to add something? Yeah.
I think
sure.
That largely you see that, as I said before, knowledge has no borders and is largely shared and increasingly shared. So that's the good news. But the bad news is that health is still largely a country issue, the way it's managed. And the response is still pretty much within the borders and not beyond the borders. And so definitely, I think we need, and I don't have a clear answer for that, but we need to see that the responses need to go beyond the borders, and that's definitely a challenge. At the same time, it's very difficult to explain in terms of preparedness. Basically, the systems that are in place are systems for the everyday challenges or the everyday threats. And you cannot expect those systems to go from 0 to 100 in a matter of days, unless you build specific systems to be able to respond to that. So if you have a hospital, the capacity to respond to that, or you have public health services, you cannot expect to have those regular services be trained and have the capacity to respond to the very quick and intense demands. And this is what we're seeing, is that just systems are overwhelmed. And that means that it's not only political, but it's also in terms of the technical response, the technical specialized response to these global challenges, these global threats, need to be thought operationally in a much more developed way than currently.
Thank you, Antoni. We have Blanca Orduna asking, how do you think that the approach to the pandemic from relevant countries in the international scene, such as the United States or maybe the United Kingdom, that took a different approach, at least at the beginning of the crisis, can affect both the development of COVID-19 internationally and the relation of those countries with other countries? Lorenzo, would you like to add some thoughts on that, given that you work for a long time as a science advisor in the UK?
So this is a very tricky question, and only time will tell. Obviously, when this disease outbreak started, it started in China, and from the Western countries, we thought, well, this is something happening in the East. It will not be happening here like previous infections in the past. And I think we didn't take the right measures in all our countries to get prepared for this threat coming. And now, quite the opposite, China is taking advantage of that situation and is getting more traction in the diplomatic community, is trying to be the one providing help and assistance to those countries that are now suffering it. And initially we could have thought that role could have been implemented or given by other superpowers like the United States. But the United States is approaching the matter with a different perspective. It's a more protectionist approach, more realistic approach. It's also because of the administration that is nowadays there. And we don't know how this may change the international political system and how diplomatic relationships are taking place in the coming future. But it's going to have an impact. And there is a window of opportunity for the European Union to share its model as a leading country or as a leading project of integration and coordination. But we need to take the right decisions, as I said before. In regards to the UK, it's true that they started on the on the wrong path, but the scientific community spoke up. There was this Imperial College report that just changed the mind and the type of scientific advice that was provided to government. And they are now taking other actions more similar to the ones that have been taken in Spain or in Italy. But they are like 10 days behind. So let's see how it evolves and how they make up of their whole science advisory system situation and how they tell the story internationally and what it has worked and what it hasn't. You will be having an expert from the United Kingdom in the second webinar, so I will not be saying anything more regarding the UK.
Sure, we actually have many questions today regarding the role of EU, European countries, as well as some examples from different Latin American countries. Unfortunately, since we are short in time and we have two webinars particularly focusing on the EU and Europe and Ibero-America, we'll have time to further discuss that. So I'm really sorry for all of you that were asking questions regarding that. There is a question from, well, several people is asking that. We have Ariana Trejo and several others, mainly asking, what can citizens do when governments don't act? What role does science play here? Dr. Plasència or Julia, would you like to add some thoughts on that? I know it's a sort of a tricky question.
Yeah, well, I think that one of the added challenges of our complexity, maybe we didn't use that term, we mentioned the term uncertainty, but I like the term complexity because that's where we move. So things have somehow need to be seen from a network perspective, with many permanent interactions, online, on-time interactions, and so definitely complexity and uncertainty interact and make it very difficult. And within that grid, there are citizens. One of the things that we are seeing is that it's really difficult for citizens to understand what is real science, what is opinion, what is unvalidated data, what is fake news. So definitely that's very difficult to sort out in the short term, and I don't have answers for that. At the same time, in democratic countries, citizens, this is a type of things that you need to build in times of peace, not in times of war. And so definitely the more and the closer the citizens will be to decision-making levels, parliaments, governments, scientific societies, other stakeholders, scientific and diplomacy stakeholders in this case, in times of peace. So when no outbreaks or when no epidemics, the easier it will be, or the less difficult, I should say, it will be in times of war to bring their voice to this decision-making process.
Definitely. Sure, please, Julia.
There are certainly examples in the U.S. of citizens and we have very decentralized governance structures as well. So you had the case of some states moving forward with shelter-in-place orders, for instance, when there was a lack of such an order at the federal level. And you had businesses choosing to move their employees on mandatory telework in advance of a federal decree to do so, for instance. You had school districts responding to the outbreak in their areas on a different timeline. So there are lots of examples.
So to answer this question, if we believe in the democratic values and we believe that we live in democracy, etc., the role of civil society is more important than ever. This whole discussion cannot be a discussion between elites, between the technocrats or between the scientists and diplomats or policymakers. No, the society needs to have a voice in here. So the role of civil society organizations, NGOs, and etc., to provide also scientific evidence that they may get access to is very important. But also the role of parliaments is truly important. Parliaments as the body that needs to scrutinize what a government is actually doing and to check balance and to check what is working and what is not. So there should be ways for them, for society to be able to put up public calls or public resolutions or public actions into parliaments if the parliaments and the opposition parties are not taking any action in there. But obviously we are living in an emergency situation, and I think all of that will be taking place in the coming weeks and months.
Cities and the role of technology. We'll have time to discuss that. I'm afraid we're running out of time, so we'll need to wrap up. I encourage everybody to continue the conversation using the hashtag SciDeepTalks on Twitter, so we can continue discussing that. And I'd like to thank you three and Ilona, who already had to leave, for your super interesting insights today. And to our audience, as we start today, there is definitely no doubt that science across all relevant disciplines will continue to play an important role in informing critical decisions and helping to guide response and recovery. The scientific community, in partnership with decision makers at all levels, has been involved in conducting, organizing, and communicating science during crisis. But as our speakers pointed out today, further progress is needed. Best practices must be defined, a research agenda put in place, probably policy reforms must be initiated. Today we have seen that science diplomacy has many long-term benefits. It can foster interdisciplinary collaboration within and among the scientific community, emergency response managers, local community or civil society, federal, state, and local governments, and the private sector. In a globalized world, we cannot afford to ignore health risks arising in other countries, as we were discussing earlier. Increased globalization and interdependence should not be regarded as purely economic phenomena, which enables firms to establish manufacturing and supply chains operations worldwide. We also have a responsibility to establish support mechanisms that help others address emerging health threats. This is also globalization. Faced with a global epidemic such as COVID-19, Political leaders should be guided by scientific evidence, not anecdotes or xenophobia. Global health and science diplomacy, I'm pretty sure, could save countless lives. I would also like to take this opportunity to remind you all that applications for our Science Diplomacy Summer School are now open. This first of its kind 1-week course to be held the second week of July in the city of Barcelona and organized by SciTech DiploHub, the Barcelona Institute of International Studies, together with other legal institutions, will allow you to get certified in science diplomacy and further into some of the topics we have been discussing today and that we will be discussing during the next 4 webinars in the upcoming weeks. Thank you very much for tuning in today, and please join us next Thursday at the same time to discuss the role of Europe and the EU in the COVID-19 crisis, the differences in the response of European member states, and the main lessons learned from this pandemic. Don't forget to register. You need to register to each one of those webinars. Thank you so much. Stay home and stay safe. See you next week.